So let's start when the patient comes into the hospital. You see them in the emergency room, you do a history and physical, and that's day number 1. In the history and physical, the most important part is the history of present illness for certain conditions like chest pain and syncope and acute neurologic changes, conditions like that, and also the assessment and plan. Now, of course, the whole history and physical is important. The review of systems is important, family history, allergies, physical exam, all those are important. But the most important part is the history of present illness and the assessment plan. In the assessment plan, you put everything together. You tell people what you think is going on. You tell people what the chest pain is due to and why you think it's due to that. And then you go through the plan of care, whether it's diagnostic or whether it's a treatment plan. So assessment plan is really important. And you also have to do it in a problem-oriented fashion. You really should do an assessment plan for every problem. So if someone comes in with chest pain, you do an assessment plan for that chest pain. If they have a history of COPD, you should mention problem number 2 is COPD. And it could be stable, not a problem, or it could be also not doing so well, and here's what I'm going to do for the COPD. But you really should do the assessment plan in a problem-oriented fashion. And we'll talk in a minute about the problem list, because that's critically important if you're going to be a high-quality documenter. The history of present illness is important, especially in conditions like chest pain, syncope, dizziness, abdominal pain, because many times the diagnosis is made based on that history of present illness because all the tests are normal. Now, if someone comes in with abdominal pain and you do a CAT scan and they have, bowel obstruction, well, the history of present illness isn't all that important because it's so obvious. But many times people come in with serious abdominal pain and all the tests are negative. So how do you figure out what's going on? Well, you figure it out by talking to the patient, by asking them the 15 clarifying questions that you need to ask about abdominal pain or chest pain. Let's talk for a minute about the history of present illness of chest pain, because I think it's a really good way to illustrate how to be a high-quality doctor and how to provide high-quality documentation. When someone comes to me and they have chest pain, I want to know, when did it start? Is it getting better or worse? What brings it on? What makes it better? Are there any associated symptoms? Why are you coming to me today rather than last week when it started? What do you think is the cause of that pain? So there's 15 kinds of questions you can ask. And as you can imagine, if the chest pain is worse when I move my right shoulder, well, it's probably musculoskeletal. If the chest pain is worse when I exercise and gets better when I rest, and it's better with nitro, and it's kind of a heaviness or a squeezing, well, that's unstable angina or maybe an MI. If the chest pain gets worse when I drink orange juice, well, maybe it's reflux disease or maybe it's an ulcer. So there's a lot of causes for chest pain, and in order to get to the bottom of it, if the EKG is normal and if the lab tests are normal, the really key is to do a history of present illness. And in my opinion, when someone comes in with chest pain, syncope, acute neurologic change, abdominal pain, in my opinion, the best doctors know probably what's causing those symptoms after they've spoken to the patient, before they've done the physical exam, before they've reviewed the labs, the tests, and the x-rays. They know what it probably is, and most of the time they're right. And that's the kind of medicine I think we all should be practicing. We're not always right based on the history of present illness, but the history of present illness gives us a really steep leg up in making the right diagnosis, especially in those kinds of symptoms where it's not clear always from the testing.